I am a stage 4 cancer survivor. I survived cancer in 2001. And full disclosure, CTCA actually gave me some counseling that really helped me recover from pretty extreme chemotherapy treatments that saved my life. And I'm looking at COVID-19 and the real threat that it represents to all Americans, but specifically cancer patients. But compared to what's happening with COVID, we need to keep in mind that cancer itself is the number 2 killer in the world. Can you give us a sense for some of those numbers?
So to give you some perspective, cancer is the second leading cause of death in the world. Approximately 10 million people, unfortunately, will lose their battle to cancer every single year. In the United States alone, that number is close to 700,000 deaths from cancer. Every single month, approximately 20,000 women will be diagnosed with breast cancer. Every single month, another 11,000 will be diagnosed with colon cancer. So if you just look at the last 2 months of this COVID pandemic, it's quite possible that 20,000 plus 11,000, so roughly 60,000 patients could have had a delay or a miss in their diagnosis of cancer. So we cannot afford to miss those cases. The bedrock of cancer therapy has been early treatment, consistent treatment, and complete treatment for the last couple of decades. What we know for sure is that if we don't treat these cancers, the patients unfortunately will die. This is the very definition of a life-threatening illness. It is the battle of a generation. It is one of the most horrible diseases that we are fighting as medical professionals and as humanity. At CTCA, cancer is the only thing that we focus on, and it's all that we focus on. So with respect to the COVID-19 pandemic, we have a unique position in that we are able to continue to focus only on cancer care and really make sure that we are maintaining the highest of standards and the safest approach to treating cancer. During this crisis, I've had the opportunity to talk to dozens of cancer patients myself, in addition to the hundreds and thousand or so patients that we've had the pleasure of giving care to. I'd like to share a few of those stories with you. There's so many that stand out to me. One is a woman in Oklahoma. Her name's Robin Roberson. Gave us permission to tell her story. She's a public servant in Oklahoma. She was diagnosed with breast cancer, and she knew that she had a history of breast cancer in her family and that her cancer was aggressive. Unfortunately, she was facing, like so many other cancer patients, was facing a delay in her treatment. And so she called, and her doctor called Cancer Treatment Centers of America, and we were able to get her in very quickly, perform her double mastectomy surgery, and get her the care that she needed, in a timely and comprehensive fashion. So, very emotional to have a chance to get to know so many stories like Robin's. There's another woman who was a 72-year-old grandmother. I remember meeting. She had survived her cancer once before. She'd lost her husband to cancer. She had come to our hospital in the Chicago area because all of her imaging had shown that she had a tumor, an aggressive tumor, but her facility that she normally got primary care at was unable to perform the biopsy and the surgery. She wasn't willing to wait, and we felt that it was definitely an aggressive type of cancer that should have been treated. So we got her in literally the next day, did the biopsy, and she received the results. It was stage 3A adrenal carcinoma, and she's already getting radiation therapy, and hopefully will be on her way to recovery. So these stories are so common. I see a combination of things during this disruption. I see facilities or doctors that want to be able to provide care, but some sort of monolithic statement is either being misinterpreted or interpreted correctly, and patients cannot get in. I'm also seeing patients who are getting confusing messages about delaying their treatment or things like that. And then I'm also seeing patients who are not wanting to go to a location that might be overrun with COVID at the moment, and they want to go to a cancer specialty hospital. So we're fighting this war on COVID. Absolutely deserves to be fought. But there's this other war on cancer, which we cannot turn our back on. I make the analogy in World War II that, you had the European theater and the Pacific theater. You didn't just lay down all your arms in the Pacific theater and say, hey, we're going to wait until the European theater was done. You have to do both. Our healthcare system is a very antiquated system. It is not nimble. It has been one of the only sectors of the American economy whose productivity on a per capita basis has actually decreased over the last 20 or 30 years. And to talk specifically about capacity, again, we have an American healthcare system that spends approximately $3.5 trillion, every single year, close to 19% of total GDP. So 1 out of every $5 is going into our healthcare system. It should be one that has enough capacity to care for its citizens, has enough gloves and masks to care for its doctors providing that care. So a few of the things that I think that, the system will get much better at going forward is having that capacity be much more nimble, much more flexible, much more modular. I think using technology, using telehealth, if one of your capacity restraints is going to be expertise, you need a great ICU doctor or infectious disease doctor. How do we quickly use technology to deliver that? How do you leverage the private sector to deliver rapid solutions? We've seen rapid testing. Hopefully we'll see vaccine creation. Although it's not necessarily scalable yet, can we use innovations like 3D printing to get some of those masks, and other things to folks? So I think there's a lot that the healthcare system will hopefully respond to. I hope we won't just take the wrong lesson, which is, okay, let's just go build a bunch of more hospitals. The solution is to be really thoughtful, break down the silos, and be much more entrepreneurial and innovative.